Colleagues, it is a great pleasure to me to present my report on road safety in Europe as a public health priority to you this morning. Every year, approximately 125 million people die on world roads, and another 20 to 50 million people suffer non-fatal injuries, with many incurring a disability as a result. Road accidents continue to be a major public health issue in Europe, as well being the leading cause of death for children and young adults aged between 5 to 29 years old. This data makes you realize the considerable consequences for victims, their families and society as a whole. What is so frustrating is that we know that most of these deaths and injuries could be prevented. It is one of the United Nations Sustainable Development Goals to halve the number of global deaths and injuries on our roads by 2020. The Council of Europe thus needs to support international and European efforts to increase the road safety. Indeed, I firmly believe that we can help to prevent many of these road accidents. First, by raising awareness to tackle the problem. Second, by taking actions through the concrete measures proposed in this resolution. I encourage you to make legislative and policy changes in your parliaments when necessary, which will allow the implementation of best practices in an efficient way. Notably, this is necessary to obtain proper data and to make a comprehensive assessment of the current road safety situation in our countries. One of the concrete actions suggested to designate lead agencies to ensure efficient long-term policies where they do not exist yet. Some actions, like changing key behavioural risk factors, may be especially difficult in some countries, but they are an efficient element of any action plan, including awareness-raising campaigns. The committee supported the idea of including road safety education knowledge, skills and attitudes in school curricula from a very early age. Also, I would like to point out the importance of adequate training for new drivers and the necessity to protect cyclists and pedestrians, which should be the central point of any urban planning. In this report, we have proposed concrete actions to be taken, including a mandatory percentage of 10% of road infrastructure expenditure to be used on safety. I consider that coordination between international, national and local levels should be strengthened, taking into consideration the technical and scientific information from all stakeholders in order to support pilot projects and action plans in our countries. The report calls on members to encourage technological improvements in roads and in vehicles. We should also be focused on health-related issues such as alcohol, drugs and medicines use and abuse that create a danger for all road users. From a public health perspective, it is again crucial to have proper driving tests, medical checks, first aid and rescue systems. Equally, we cannot forget the importance of quality post-crash care, treatment in hospitals and necessary rehabilitation. I realise that in order to achieve these measures, governments must ensure adequate financing for road safety programmes to have safe, affordable and sustainable transport system for all. I ask for your full support to the draft resolution this morning, because if we implement the recommendations, they will have a real impact on our everyday life. An accident can happen to all of us and to our loved ones at any time and anywhere. I trust to convey this message to your national assemblies. Thank you very much.